mission of the founding sisters and the charism of trust in Providence is alive and active at Providence Care, under the direction of the present Board of Directors and CEO, Dale Kenny. One final example of the mission of the founding sisters being lived in the present can be found at Mental Health Services. When Providence Care was asked to assume the responsibility of the Kingston Psychiatric Hospital, both Providence Care and the sisters were delighted. I remember reading the history of the Kingston Psychiatric Hospital. How wonderful and innovative their early founders were. For more than a century, Kingstonians had had a dedicated staff with a specific calling to care for the most vulnerable of our society. They did it well. Therefore, it seemed a proper and good fit for the two entities who shared values to come together to serve present Kingstonians in their mental health needs. So whether at Providence Manor site, St. Mary's of the Lake site, or Mental Health Services site, we sisters know the mission and values of the Sisters of Providence of St. Vincent de Paul are alive and well. We thank you for including us in your celebration, but we thank you mostly for your service and wish God's blessings as you continue into your future.
Healing through mental health. The story of Mental Health Services is all about people caring for people. Reading through the history, the theme that emerges is a theme of community, and community from three perspectives. From the perspective of a caring community, developing a caring community in partnership with people we serve. A theme of linking to the broader community, of challenging stigma related to mental illness, and promoting dignity, respect, and understanding in the wider community. And a theme of serving people in the community where they live. It all started back in the early 1800s when individuals living with mental illness were housed in the basement of Kingston Penitentiary, and the need for an asylum was identified. That need was met when the Rockwood Asylum was finally established by John Palmer Litchfield. Litchfield arrived in Canada by way of the debtors' prison in Australia. He was a charming and persuasive man and a friend of Sir John A. Macdonald. He acquired a license to set up a private asylum in the Rockwood Villa, which still stands on the grounds at Mental Health Services. He then proceeded to renovate the stables at the house to house 24 women who had previously been in the basement of the penitentiary. Construction ensued, and eventually the asylum opened in 1862. Litchfield was also one of 6 men who founded Queen's University Medical School. He was a little bit unorthodox in that towards the end of his tenure it became apparent that Litchfield wasn't in fact a doctor. So arrangements were made by Queen's faculty members to test his knowledge, and he obtained a medical degree. In the late 1800s to early 1900s, there was a real determination to improve care, and we started to see innovations in care that would make a real difference in the quality of life of people we served. Mechanical restraint was abolished, and the use of chemical restraint was diminished. The first occupational therapy program began in 1870. We also saw improvements in clothes and food, and mattresses were no longer straw but were stuffed with hair. There was an expansion of activities to include diversions such as bowling and drama clubs. Interesting, patients were involved in everyday activities, but also activities were planned in such a way that the broader community was drawn in to participate in football, hockey, and basketball leagues. as well as to enjoy performances of the brass band and the orchestra. Education was seen as a way of improving care as well, and we saw a school for psychiatric nurses established and the first formal lectures in psychiatry offered at Queen's University. In 1914, after almost 2 decades of advocacy, an aftercare program began with social work and visiting nurses. The premise for the aftercare program is almost as true today as it was then. They felt that a certain proportion of patients could get along very well in the world if they were able to receive very slight protection and care. Unfortunately, patients return sorrowfully but willingly because they find little sympathy for their afflictions. During the Great Depression, the hospital acreage was turned into a working farm. Patients worked alongside staff in many aspects of the hospital routine. People who came to the hospital with skills such as accounting became assistant bookkeepers. They assisted with farming. During the summer, 30 or 40 patients and staff would line up with push mowers and mow the grounds and get it all done in a day. On walks, patients would stop and rake the leaves. There was a real sense of community, which may well have grown out of the fact that initially staff actually lived on the grounds with patients. And until 1904, the nursing staff lived on the units with the patients. So by 1950, the idea of a farm fell out of favor, but we were also starting to look even more at opportunities to support people in the community, with a really strong belief that many people with the right support could live full lives in their communities. In 1931, a traveling mental health clinic was established, and it went out to outlying areas that had held offices or clinics in town halls, schools, general hospitals. And the referrals came from all over, from family physicians, public health, children's aid societies, courts, and families. Staff was expanded to diversify and add social workers, male nurses, and clinical placement started to be provided for students in social work, theology, and occupational therapy. In 1959, the building we're now in opened with 500 beds and a strong affiliation with Queen's, who one had space allocated for teaching and research. Over the years, it had been apparent there were quite a number of people we served who were elderly, and that there was a need to develop a specialty in geriatric psychiatry. And we saw that emerge in 1970 under the leadership of Dr. Rodenberg. We also started experimenting with housing and developed a group called Friends of Kingston Psychiatric Hospital. This group eventually developed into Kingston Friendship Homes, or what's now known as Frontenac Community Mental Health Services. There was significant outreach as well to communities, a real drive to promote an understanding of mental illness and to ensure that folks who we serve were treated with respect and dignity. So we saw efforts going into the founding of the Schizophrenia Society, the Alzheimer's Society, the Kingston branch of the Canadian Mental Health Association. And we also saw innovations in the areas of outreach and provision of assertive community treatment. One striking statistic is that by the 1970s, outpatients outnumbered inpatients at mental health services by 3 to 1. If we look at it today, the ratio is more like 300 to 1. So just reflecting for a minute back at the beginnings and our commitments to people and to community, I think today we still see a commitment to a community of compassionate caring. We see a commitment to advocacy to decrease stigma associated with mental illness, and a commitment to ensure that people we serve are treated with respect and dignity. And finally, a commitment to enabling individuals to live their lives in the community of their choice.
We come to the point where we speak about preparing for the future. This is a great afternoon as we gather in the comfort of this historical chapel to joyfully celebrate the 150th anniversary of the mission